with Mandy, who is prepping for her Pan-G treatment. Now, can you tell me what the experience is like? What does it feel like?
Basically, it feels like a pinch in your cheek. It's not very painful, whereas it would be like a needle or anything like that. It's basically like a pinch over and over again for about 20 seconds, and that's about it.
And why did you want to get this treatment? Why did you start getting this treatment, and why the non-surgical Pan-G procedure?
Well, first of all, I don't like needles. I'm that kind of a person, and I basically would rather do something where it would tighten my muscle all up around in my eyes and stuff like that. So I'd basically prefer to do something like that, whereas for me to have a small phobia of needles and stuff like that, I would choose not to do that. And it does take a little bit more effort and time and more maintenance, but I'd much rather, because I don't have to do anything afterwards and go straight to work, and it's much easier for me in my lifestyle.
Are you happy with the results?
Very happy with the results, yeah.
And how has it changed your quality of life?
It's just made me happier, more confident in myself. My job, I do work with a lot of clients, and my appearance is very important, so I'm a lot more confident in myself, and I'm a lot happier.
So you have noticed a major difference then?
I have noticed a major difference, yes.
All right, well, we've got more still to come from SpaMedica, where we are going to learn more about the Pan-G lift with Dr. Mahone.
Beautiful, thank you very much, Xana, and much, much more coming your way. Sam, floor is yours.
Right now we're going to learn about the Pan-G facelift. How is it different from a laser surgery?
The Pan-G is totally non-surgical. There's no knife, there's no laser. It's designed so patients can come in for half an hour to an hour twice a week over 10 weeks. And at the end of that process, we want to significantly lift and rejuvenate their face, brow, cheek, and neck tightening. It works on multiple levels using things like sonic peels and injectable plumpers that we've talked about, the Botox, but most importantly, working on the facial muscles that hold that soft tissue and getting that soft tissue up higher, the cheeks, the brow, and the neck being tighter.
So is it similar to a chemical peel?
No, it's totally different. It's passing high voltage electrical current through select muscles that elevate the cheek and the brow, or high energy, high frequency ultrasound to rejuvenate the skin. So it doesn't use chemicals. There is no flaking, no redness. Clients can have their lift and leave the clinic feeling rejuvenated and substantively younger.
And how long is the recovery period?
There's no recovery. Like most of the things we do down here, we want it done, the enhancement immediate, and we want our patients to go right back to their activities.
And how long does this procedure take?
The whole process is 10 weeks. It's twice a week for an hour, and then the patients go on to a home program. We've designed it so they come back and see us in the clinic once every 6 weeks or so, or if they want a home unit, they really can do that at home and see us twice a year.
Okay, and how much does this procedure cost?
The lift itself is $29.99, so approximately $3,000, which is quite a bit less than most surgical lifts. And again, there's no time off work and no recovery. And patients can either pay cash or they can finance that kind of expenditure. So it's not cheap. To look your best is not cheap. But when you understand that most young women between 22 and 25 will spend between $1,500 and $2,000 over the counter on cosmetics, on creams, and lotions that make no histological or clinical difference in their appearance. Investing in something medical that has proven outcome is much more economical.
All right, well, thank you very much for your time, Dr. Mahone.
Thank you.
All right, more to come.